gonna move on to the knee. Knees can range from 2-view knees, 3-view knees to 4-view knees. I'm gonna show you the typical knee, like the typical shoulder. There is an orthopedic variation, but all we're gonna worry about is what you usually see, which is an AP, medial oblique, and a lateral knee. So that's what we're gonna do. You shoot this in the table bucky. Up until now, the lower extremity work we have done has been tabletop, but knees are typically over 10 centimeters all the way around, and so you move into the bucky. It cleans up the picture quite a bit. So you want to make sure you're detented left to right, and then you need your SID to be about 40. You be on table bucky, so you'll set your technical factors outside the room before you come in, and then your angle on a knee actually varies from caudal 5 degrees all the way to cephalic. So typically on my AP and lateral, I use cephalic angle of approximately 5 degrees. The bigger the hips, a little bit more angle. So there we go. So we can get that going. Make sure you're on PBL, positive beam limitation. You'll learn all this in class. And I'm gonna move some stuff. I'm trying to stay within the range of my camera. So just like that. I like to mark inside on the bottom, but you can also do it here on the table. So we'll do it on the table so you can see it. All right, so you center the middle of the knee about an inch distal or a half an inch distal to the patellar apex. All right, put your foot straight up and down. You need the leg nice and straight. The apex of the patella is at the bottom of it. So our tube and bucky are lined up. So all we're gonna do is release the table and move her just a tad here. I need to move down a little bit. So what I'm actually gonna do, because the way I'm set up, I'm out of table range. I need you to scoot up. There we go. Perfect. So now I've got some play here. You guys are gonna run into that. Just nice. The Jill is such a nice and easy patient. So you want to be, again, a half an inch below the patellar apex. I don't collimate top to bottom really on my knee, just left to right, just like that. That angle, we're all centered, and AP knee, it's perfect. All right, so once I do that, I do not have an angle on my oblique. So when you take that angle off, recognize you're not going to be lined up with your bucky anymore. So you need to make that adjustment. So just do it as soon as you take the angle off and center back up. Then, okay, man, what I need you to do is roll your leg in as far as it'll go, right about there. Straighten it the best you can while it's rolled in. Super awkward for this one. Some people are like, I can't. So you can always put a sponge under their butt to help support them. But your centering's virtually the same as far as superior to inferior, but you'll notice that there is a shift when you roll in. So you've got to make your adjustments. The goal of this one is to open up that fibular joint space here between the fibula and the tibia. And so the head just kind of sits at a funky angle. So if you can visualize it as you roll in, you'll see it. But it takes quite a bit to get it. So then just make sure you haven't clipped on the inside, because that could be awkward to see. Make sure you're over bone and not soft tissue, and that's going to be your medial oblique. Okay, go ahead and relax. It's a little bit uncomfortable, right?
A little bit.
And then the last one is your lateral. So again, like I said before, 5 to 7 degrees or so on this. Let's say 5. And we want to fix, make sure we're nice and lined up with our bucky again. I don't think you guys can see that, but that's okay. And this one's awkward. So you ready?
Yeah.
All right, I need you to roll all the way up to your right side. Bring your left leg in front of you, if you would. Just like that. And then you're gonna lay this leg all the way out and bend your knee about right there. Perfect. And this is like, okay, pretzel time, right?
Yep.
All right, so then you just want to be about an inch below the condyles here, right there. You want to project this, remember you've got an angle, so it's coming up. So you want to go through them, mark anteriorly. And the big thing with this is this will come almost straight down the femur will, and this will come out the edge, the tibia. So that's a pretty good angle. It gives you the right space with the patellofemoral space. And then you just kind of drop down and take a look at what you got here. So viewing that, if the patella is lateral, you're about square on that. So that's what you're looking for. There's a couple things you can do. Roll in just a tad. There we go. And that's going to get it too lateral. In order to get that, though, you're really just going to have to practice seeing it in positioning and then looking at the x-ray. What did I do? What did that look like? And over time, you'll develop x-ray vision is essentially what we like to call it. So that is a lateral knee.